Hi guys, Pesky Girl here. We're going to start our studying by history taking and examination. Since you are all medical doctors and you're already familiar with examination and history taking, we are going to talk about some tips that we should do in our history taking and examination. Now, the first step in taking history is appropriate introduction. If you don't know the patient, you can say, "Hello, I'm Dr. Kevin," or "My name is Dr. Kevin and I'm a general practitioner." If you know the patient, you just say, "Hello, Mr. Jones, how can I help you today?" Always start your history taking with open questions, such as, "What brought you here today?" Then you can narrow your history taking by going to probing questions like, "Can you tell me more about this, please?" Do not try to use leading questions. For example, you shouldn't say that "You haven't passed any black tarry stools, have you?" A very important thing during history taking is to pay attention to the patient. If you feel that patient is in discomfort or the patient is in pain, for example, a headache, you should offer painkiller so that the patient can be more relaxed. Also, if you feel that the patient does not speak very well English or he or she cannot understand you very well, you should offer an interpreter. Another very important thing in history taking is ICE. You may hear this a lot. It's short for ideas, concerns, and expectations. Let's break them down. Ideas. If you ask patients about their idea of their symptoms, on many occasions they give you a hint. For example, you should ask patients, "Have you had any ideas about what might be going on?" Or you can also ask, "What do you think might have been causing this? Can you think of anything else that might have caused this?" Another very important part is concerns. This is patients' worries and concerns. You can ask, "Do you have any particular concerns about what are you experiencing?" For example, if patient has a headache, you can know that it's a simple tension headache, but the patient may be worried about some tumors or cancer they have been reading on internet. Another part is expectation. Sometimes patients expect certain thing to be done in the sessions. For example, if they have a back pain, they might expect a CT scan or an X-ray, but sometimes it's not even required. But when you know what patients expect, you can manage that expectation by explaining to the patient that is it necessary to be done or not. When you want to ask about sensitive or private issues, such as sexuality, you should warn the patient before you ask anything. And you should also explain the privacy and its boundary. For example, you can say, "Now I'm going to ask you about some sensitive questions. I can assure you that whatever you say is confidential and stays between us, unless there's a danger to you or others." When you ask about patient's pain, it's important to get answers to some factors. First one is location or site of the pain. For example, if a patient has a headache, is it in the forehead, back of head, unilateral or bilateral? Onset, is it going on for 3 months or has it just started from last night? Character, is it thunder-like pain? or is it a throbbing headache? Radiation. Does it radiate to any part of the body? Aggravating and alleviating factors. What the patient does that makes the pain worse or better. Associated symptom. For example, in case of headache, is there any fever, any change in vision, or things like that. Severity of the pain. You can give a scale from 0 to 10, 0 being no pain and 10 being the worst pain that the patient can imagine. Before starting your physical examination, you first should take consent of the patient, wash your hands, and expose patient as much as required. You should always explain to the patient what you are doing. And especially if you are a male doctor, you should offer a chaperone. We should offer chaperone when the patient requests a chaperone during an intimate examination where a patient appears particularly reluctant or distressed to be examined, where the doctor is uncomfortable in examining the patient without a chaperone.